Hello, everyone. This is Deb from Deb's Data Dojo and Calling All Beings. I'm here to introduce the UAP Medical Coalition and a few of its members. They have graciously agreed to join us for a Q&A session live on YouTube. Joining us today is Les Velez. Les is the co-founder and chairman of the board of OPUS, the Organization for Paranormal Understanding and Support. Les is also an author, a founding member of the UAP Medical Coalition, and the head of the mental health team at UAP Med. Ron is also here today. Ron is a PhD in sociology. He has a PhD in sociology. He's a professor, author, and member of the UAP Medical Coalition. He advises us on psychosocial aspects of the phenomenon. And last but not least is Ted Roe. Ted is the director of UAP Med, but is best known for his work with AIAA and, of course, NARCAP. So today we have a lot of questions that we picked out from the audience. But before we get into questions, is there anything you'd like to say about UAP Med in general?
We were established in response to changes in the understandings about unidentified aerial phenomena. And when the Office of the Director of National Intelligence acknowledged that UAP exists and cited three areas that they affect: national security, aviation safety, and stigma, it was clear that there are underserved populations in the mental health arena that need some attention now. So I reached out to Les and a number of other people around me and started trying to pull together an organization to help facilitate understanding with the community of professionals about unidentified anomalous phenomena.
So thank you very much. And Ted, the very first question is, what does UAP Med do?
Our mission at UAP Med is to inform the mental health and medical community of professionals about unidentified anomalous phenomena, or UAP, to encourage research and to improve patient care.
And Ted, what is UAP Med a business?
At this point, UAP Med would be considered an unincorporated association, or not even a nonprofit 501c3. Nobody's making any money here. We have no paid staff. All of our expenses are being met by our volunteers.
Okay, this next question is for both Les and Ted. Okay. Um, who are the affiliates and what does it mean to be an affiliate for UAP Med?
Yeah, thank you, Deb. I'll answer that question. Affiliates are people that are aligned with the way we are thinking, and certainly OPUS is one of the organizations, the Organization for Paranormal Understanding and Support, that I co-founded with a doctor friend of mine years ago, 1994, and we are officially a nonprofit organization. But there's other organizations that we are also affiliated with, Project Bat Tech. We're always looking for other organizations to be affiliated with that are of like mind. The bottom line on all of this is that we're trying to make the mental health, the medical community more aware of the phenomena that's going on, where people are talking about being in contact with non-human intelligences.
Did you want to add anything to that, Ted?
The issue is that there are underserved populations. I ran NARCAP for 20 some years and dealt with pilots who had had these unusual encounters while flying their aircraft during their professional careers. And it was clear that they suffer from issues around stigma and that they have issues of trauma and anxiety that arise from these exposures. And it's very consistent with other subgroups that you read about in the literature who have these exposures.
Sorry.
And it's really time for us to go ahead and develop a response to that. We're acknowledging that the things exist. So now the next thing to do is understand how they affect individuals, how they affect society. And so we look for affiliates who are they're sort of we're a hub and they're spokes who are actively engaged, and we try to support and work with them synergistically.